Welcome back to another episode of Novus News. I'm Stephanie Wolff, PA and CEO of the Novus Center here in Studio City.
And I'm Jada Pascal. I'm the registered nurse here at the Novus Center.
So today we found a clinical study that we wanted to share with you. And in this clinical study, it was performed through the International Journal of Women's Dermatology, and it's going through the 7 most researched treatment options for cellulite. So I know that you guys, you're doing your own research and you're calling into different clinics and you're kind of thinking, well, what's the best treatment for me and what do all these treatments do? So that's what this episode is about. We wanted to give you all the information and that way you can make an educated decision on what you'd like to do.
Yeah.
So Jada, if you don't mind, will you just read the first sentence explaining to patients exactly what cellulite is according to this clinical study?
Yes. So cellulite is basically the herniation of the subcutaneous fat. So basically the fat cells through the dermal layer, and where fibrosis of the collagen septa leads to the shortening and retraction. So basically these fibrous bands are retracted and they are pulling onto the dermal layer and causing this dimpling and the lumpiness.
Yeah, and as the study indicates, 80% of cellulite happens in women over the age of 20.
Yeah.
80%. You guys, that's insane. That's how many of you guys are researching this. So I want to talk about the first one they talk about, and that is going to be topical agents.
Yes.
So we do use a topical agent here at the clinic, and it's a combination non-peptide cream, and it's called a glycerotinic with aminophylline cream. It's a combination. And what these two creams do together is they help with lipolysis or fat cell breakdown.
Right.
They also are going to increase angiogenesis, which angiogenesis is the formation of new blood vessels.
Right.
So as we were talking about before, when you have these enlarged fat cells, you're kind of restricting the amount of blood flow that's now able to feed that dermal layer, that tissue, that collagen. So if I could give you a cream that's known to break these fat cells down and promote angiogenesis, blood flow, then I'm able to feed that tissue and promote collagen production. So actually there was a study where they used this cream in obese women for 12 weeks. They applied the cream twice a day for 12 weeks, and they actually lost 11 to 12 centimeters of their waist circumference, which is huge.
Yeah.
So, they are using this for fat loss, obesity, also for glucose and lipid metabolism because it helps restore glucose levels. So we do use that one. The second topical agent they talk about is the retinoids. And, a lot of people are familiar with retinoids because they use them on their face, Retin-A, Retin-A is known to produce more collagen production, help tighten the skin. And if you're going to produce more collagen production, then you're going to actually increase the amount of blood flow to this collagen. Because as I've said before, anytime you're creating new tissue, you're going to have arteries, veins, and nerves that have to feed it.
Yeah.
The thing with the Retin-A is you have to be a little bit careful because what I've noticed just in myself is that, in the beginning of you using Retin-A, your face can become really red,
very sensitive. You peel a lot.
Exactly. So, Retin-A is not for everybody, but do know that that is one of the options here that they gave us in this clinical study.
And the next one that they talked about here in the study is radiofrequency and laser and light therapy. And what radiofrequency is basically you're heating up that tissue. And when you heat up anything, you are opening up all those blood vessels. And so you're just allowing more blood flow from entering. And in those blood vessels, you have fibroblasts, but basically is collagen. And so we're just increasing that collagen production into that dermal layer. So, radiofrequency and laser light just open up that blood vessel just to help with the circulation. Radiofrequency also helps with lipolysis, which is basically the breakdown of the fat cells. And it says here on the study that you have 8 to 16 treatments, and it increases circulation, it stimulates adipocyte metabolism, fat breakdown, and mechanical stretching of the fibrous cords. So it helps those fibrous bands that I was talking about earlier that are retracting and pulling on that skin, that it helps them to be more elastic. And for the laser and light therapy, like I said, it's heating up that cell, so it's increasing that blood flow.
Yeah.
However, the only thing that it does not do is that it doesn't break down fat, and it does not help the fibrous bands that are retracted.
Yeah. And I believe they said with the laser and light therapy, they were specifically looking at the ND-YAG. And with that treatment, it is only one treatment that you would be going through. And it's just kind of allowing your body to heal. So I can imagine if you're going through one treatment with this thermal energy, you might have some bruising or swelling, that kind of thing. The other thing they talk about is the only FDA-approved treatment for cellulite, and it's called Cellophena. So what is Cellophena? Well, it's actually, I like to think about this as kind of like an outpatient procedure, because you have to inject or you're giving a topical anesthetic, and then what they're doing is they're putting needles below the skin surface, and they're actually cutting the fibrous cords. So they're not really shrinking the fat cells, and they're not promoting collagen, and they're not getting rid of the scar tissue. They're just cutting it, is basically what they're doing. They did show that this treatment does last for up to 3 years. That's as far as that study goes. So we're not really sure what happens after 3 years. But again, since it's, to me, kind of like an outpatient procedure, because you're going in and you're having to do some lidocaine and you're snipping underneath the layer of the skin, you're gonna have bruising and swelling and a little bit of pain and discomfort. So just kind of know what you're getting into with that one.
Right.
The last ones that they talk about are the injectables.
Yes, the collagenase and dermal fillers. So what collagenase is, it's basically the enzyme that breaks down the peptide bonds of collagen. And collagen, I know we're talking about how that helps the skin and makes it look smoother and appear smoother. But collagen can also be a form of scar tissue. And like I said, those fibrous bands that are pulling on this dermal layer has scar tissue at the bottom because of the lack of blood flow. So when we're injecting that collagenase, it's breaking down that collagen, that scar tissue that is causing this dimpling.
But not really promoting collagen production or blood flow or anything like that.
Right.
And it is an injection.
Right.
Yeah.
Yes.
And, just like the dermal filler too, what they're using is calcium hydroxyapatite in this study. And as the name suggests, they're using calcium hydroxyapatite. And so they're injecting, think about it like regular dermal fillers, but it's very similar to any kind of acne scarring. And so they're kind of injecting within that dimpling region. Again, when you're doing any kind of dermal fillers, it's not long lasting. Everybody's a little bit different. And sometimes what can happen with the dermal fillers is they can kind of calcify, or maybe they just don't look exactly how it looked when it was first injected. It just kind of depends on how your body responds or reacts.
It's a foreign thing that the body is accepting, and so it
sometimes can create like scar tissue around it too. So I just want you guys to be fully aware about all the other options out there and just how they're supposed to help cellulite, and what are some of the side effects, and exactly how or what it's treating. And then that kind of brings us to the last treatment option here in this clinical study, which is our very own
acoustic wave therapy or shockwave therapy, what we have here at the clinic.
Right.
And in our previous videos, we talked about how shockwave therapy helps with various amounts of things.
Yes.
And
don't be scared. When she says shockwave, it's not a shock. We're not shocking you. It's just sound wave technology or acoustic wave technology.
Yeah.
And basically what this sound wave is doing is it's creating the little bubbles that you were talking about in the previous episodes, which is called cavitation. So the way I like to describe it to patients is think about it like a water droplet. When you're actually using the handpiece, it's not affecting the top layer of the skin. It's actually going deeper into the surface layer telling the body, hey, there's been some damage here. I need you to send in new fibroblast production, which is going to promote new collagen formation. And anytime you're promoting new collagen or tissue regeneration, you're always going to have arteries, veins, and nerves accompany it. And arteries and veins is blood flow, and nerves is sensation. So you're basically like refeeding this tissue. You're opening up new blood vessels. You're forming new blood vessels, which is the angiogenesis.
Right.
And, kind of what she was talking about with the fat cells, the fat cells are so enlarged that they're constricting that blood vessel formation, or even like the blood and lymph drainage. And the acoustic wave therapy is going to help shrink up those fat cells, promote angiogenesis, so new blood vessel formation,
and so the fibroblasts
production, so that you can have nice thick skin again. The nice thing about acoustic wave therapy is there are no side effects. So there's no downtime, meaning there's no bruising, there's no pain,
no sensitivity,
and realistically it takes anywhere from 8 to 10 treatments. We're having patients come in twice a week for about 4 to 5 weeks, and really we're starting to see results after treatment 4. And, according to the studies here, in this one specifically, they're showing that patients are even getting longer effects into like the 3rd and the 6th month post their last treatment.
Even after the last treatment, you're still seeing that production. And we have to understand that when we cause microtrauma, or that cavitation that Stephanie was talking about, is that the body doesn't just stop after that treatment, and it doesn't stop regenerating after that treatment. So that's why we also say that even after your 10th treatment, you're still going to see that results even 3-6 months later.
Exactly. Here's a good way of thinking about it, you guys. So if you were to fall and you scrape your knee, I feel like I say this all the time, but you get a little scab. Think about how long it takes for that scab to fall off. Everybody's a little bit different. Maybe for me it's 7 days. Maybe for the patient next door it's 14 days. However long it takes for your body to heal. Once that scab comes off, you have nice pink fresh skin. How long until that pink fresh skin turns brown as if it never happened? Again, that's tissue regeneration. So it could take up to 3 months, maybe 6 months. So that's your tissue regenerating. That's how I want you to think about this whole process. So hopefully we gave you enough information so that you can make an educated decision on how you would like to tackle your cellulite treatment. If you have any other questions or concerns, please don't hesitate. Give us a call here at the Novus Center.